Welcome to From the Clinic to the Courtroom, Health Law Unpacked.
Hello and welcome to From the Clinic to the Courtroom, Health Law Unpacked with Maria T. Santi, Esquire, founder and managing partner of the health and medicine law firm. Maria and the team are focused on providing exceptional legal services with efficiency, accuracy, attention to detail, and a high work ethic. I am your host, Kevin Rosenquist, and today's episode is Denied for Mental Health Treatment? Well, here's what you can do. Maria, welcome back.
Thank you. Thank you for having me back.
We talked last time about some denials when it comes to kids and newborns. Why are mental health treatments so often denied by insurance companies, even when a provider recommends them?
So with mental health treatments, they have different levels of treatment. So a lot of times the health insurance companies, again, they're stepping in and playing doctor, and they'll say, well, this patient doesn't need to go to the higher level. They're fine at the lower level. And then they start arguing about if somebody needs, for example, residential mental health services, and then they're ready to step down. They're like, well, no, they can get intensive outpatient. That's one level. There's another one that is partial hospitalization. So it goes from internal outpatient, partial hospitalization, and then residential. So those are three levels, and that has to do with, it can be mental health, it can be substance abuse, but typically it's mental health issues. So depending on the level of care, they just, again, they have these checklists of things that they deem are appropriate, and the checklist has to be met. And then if it's not met, they say, well, nope, you don't need a higher level of care because you haven't had suicidal thoughts, for example. Or in eating disorder treatments, this happens a lot too, because of the levels. They say, well, you've gained enough weight when they haven't even finished the program. So they basically, most of the time, will say you're not sick enough to get more care.
I feel like, at least when I think about my lifetime, mental health is more, at least it's more talked about. It's more, maybe a little more understood. It's more, people are addressing it more. Do you feel like it's getting better as far as how insurance companies handle this? Worse, or is it really not changed?
I would have to say, generally it is getting a little better because of the Mental Health Parity Law that was passed years ago, and because just of different class actions that have occurred. We still do see some denials here or there. Like I said, the challenges when it comes to the continuous treatment that is necessary.
Mm-hmm.
So I think, it still can use some improvement, but I think it has gotten a little bit better.
Okay, well, that's good news. That's always positive,
Yeah.
That's for sure. What are some of the key differences in how the law treats mental health versus physical health care?
The Mental Health Parity Law actually was passed for that reason, which says that you can't treat mental health different than physical health. So basically, they have to treat mental health like a real physical issue. Sometimes there may not be sufficient guidelines to quantify exactly what that mental health is. So there's still some challenges, or if there's advanced treatments, there are challenges in getting that approved. But I think the key difference is that a lot of times it's really hard to quantify what the person is experiencing with regards to mental health. Whereas if you go to the doctor because you broke a finger or you cut your leg or something, or broke a leg, it's very easy to say, well, that body part got injured. But if you have a mental health issue, it's very hard to say, well, where is that coming from, and how does the person express it? How do you quantify it? So those would be the main differences. And health insurance companies try to do it every now and then, which is, I don't want to give an opinion on that, but on what they do. But basically, they try to quantify something that you cannot always quantify.
Yeah, it's different. It's totally different. You're right. Like, you can look at someone and tell that they have a broken arm, or they have, certain physical ailments. You can't necessarily look at someone and tell when they have a mental health issue.
Mm-hmm.
Yeah. So you mentioned the mental health parity laws. Are insurers required to comply with those? And what happens if they don't?
Yes, so they are required to comply with that. If they don't comply with it, they can get sued for violating the law. There are some health plans that were grandfathered in like after the Affordable Care Act or after that law, that they don't have to comply. Those plans are few and far between. Like there aren't that many, but they still are out there. So if they don't have to comply, it's fine. Short-term plans don't have to comply with it. So they can pretty much do whatever they want. But as far as a general plan through an employer or the Affordable Care Act, those do have to comply, and they can get sued if they don't for damages or for whatever they're preventing treatment.
Mm-hmm. So if someone receives a denial for therapy, medication, inpatient care, as far as mental health is concerned, what should be their first step?
So the first step is always, again, working with the medical provider. So in this case, it would be the mental health facility that would do the first level appeal. So communicating with them, working together with them so they can submit that appeal, and then also calling the insurance company to help the provider get these things approved. So it would be, again, going through the appeals process, getting the specialist on board. Again, a burdensome process, unfortunately, but that is what needs to be done. If there are any concerns about violation of the law, they can always call the administrative agencies that are in charge of those laws and report, the insurance company for violating those laws. And that sometimes helps. Maybe call the insurance commissioner in their state. The employer plans have the employees, the labor unions. They have labor unions. They also have the federal department of everything that has to do with labor. Like there's different administrative things, but I think the most effective thing would definitely just be get to the appeal, get it through, and get it expedited if you can.
How successful are the legal appeals in mental health denial cases in your experience?
Well, generally, I think it's like 50-50. They're not always, I wouldn't say they're always 100% successful, because I feel like the insurance companies they don't really care about any kind of different type of diagnoses or anything. It's just, listen, we're not going to we're gonna look at the appeal, and then they just go through the motions. They're not making it a different type of review because it's mental health versus a hospital visit, for example.
Mm-hmm.
So I just think it's a little bit of a gamble. I mean, if it's a very well put together appeal and it's somebody that it's a very serious situation, I would say most of the time that will get overturned. It just, the right clinical information and medical records need to be submitted with that appeal so that they know how serious the issues are.
Can mental health providers help strengthen a patient's legal case?
Well, yeah, I would say definitely, because whenever an appeal is done, it should always be the treating provider that is giving an opinion and that is providing the records, because they're the ones that treated the patient. Mm-hmm. It has to be the actual one that is recommending the treatment.
Okay. We talked a little bit about the parity law, the mental health parity law. What more needs to be done to avoid these? 50-50, it's not a great percentage when you think about an appeal. What else do you think needs to happen?
So I think it comes down to, a lot of the time, the way that things are documented. So probably mental health facilities and providers just making sure that they are documenting things in a lot of detail. I mean, typically, in my experience, they do pretty good, but there's some that they may not have a system that captures everything that needs to be captured. So then they're just more susceptible to getting denied because they're not meeting certain criteria for when claims are billed or a pre-authorization request is sent in.
Okay. For anyone listening who is planning, who has mental health, issues in their family, and they want to use insurance, what kind of stuff do you recommend that they have put together? What should they be prepared with?
I think, in a general sense, it's not just, you can't just have boilerplate everything. Like, obviously, maybe like background information and records on from when the condition started. So that's something that when we do appeals, we always want to make sure that we have everything that led to whatever situation the person is in, because those situations usually build up from something. Mm-hmm. So it's always good to have the foundation. If they have a certain diagnosis, like have that on hand where they first got diagnosed. If there was some kind of psychiatric test that said, like some kind of way to measure whatever the condition is. Like a lot of times you might have to measure emotional intelligence or intellectual intelligence, intellectual disabilities. So there's all types of specific like tests that they do for that. So it would be good to have all of that, like maybe just a file with the main things that would be needed just to lay the foundation if and when this person needs additional treatment because of their condition.
Does family history get brought in? Does if there was trauma, that kind of stuff, are all these factors brought in a case?
So those factors, it would really depend on what the diagnosis is, because the DSMV manual, like that has different diagnoses and what is required to first diagnose somebody and then to determine the treatment plan. So I think that would be very individual and specific as to the person, what their condition is, and then what exactly they're going through. And then if they have multiple different diagnoses, then that's something, another level. So it really depends on a lot of those factors. That's why working with the treating physicians is key, because they're the ones that know exactly what treatment an individual needs.
Yeah, and to your point in our last episode when you talked about putting people in a box, putting kids in a box, and it's even, I would think, even more ridiculous in a mental health situation, because talk about everyone being different. I mean, you're the way you're brought up, the way you interact with people, the way how you were born with certain things. I mean, there's so many different factors involved in mental health. How can an insurance company try to put like certain parameters on any one condition?
Yeah, so that's something they all have. Coverage guidelines that they put together from different journal articles, and they just kind of look at statistics and again the manuals, the guidelines, and they say, oh, we looked at this. But yeah, they're trying to put everyone in that box, which is not always appropriate. And they just say, well, if you have this, you need to meet this, 1, 2, 3, 4, 5, and that's just how they do it.
Given you mentioned roughly the 50-50 appeal process success rate, when someone comes into your office, what kind of questions do you ask? What are you looking for to strengthen a case?
So the typical questions that we ask, first, we need to know the basics, like what type of policy do you have? That's number one, because that's going to determine a lot of things and how things are done. 2, we need to know, have you done appeals or not done appeals? 3, it's going to be, well, has the doctor recommended this treatment? What has been recommended? And then, have there been denials? What types of denials? What are the reasons that the health insurance company has issued those denials? Because a lot of times there's different reasons that they give, so it's not always consistent. Yeah. And then obviously the medical records, like that is very important. And if we can talk to the doctor directly about the issues, that's even more helpful. But really just having all this clinical documentation and medical records to support the appeal is what is going to make this appeal more successful. Obviously, adding in the legal arguments, but all that information, the clinical and medical, and then a lot of times we also cite to medical journal articles showing the different findings for the specific treatment that is being recommended. And then that takes some additional research in medical journal databases. And that typically helps in the success of the appeal.
Do you think a lot of times people, especially in the insurance companies, just feel like people are exaggerating stuff or can think of different ways to treat their condition rather than going a medical route?
The thing is, that's worked into their business model. There's some insurance companies, like I've heard stories, there have been articles too, that these medical directors that are assigned to cases, they are actually paid based on the percentage of denials that they issue. So the more claims that they denied, the higher their salary is.
Wow, that is messed up, Maria. That is messed up.
It is messed up. So I do think they're just pushing buttons, and they really only look at things when somebody starts fighting. Other than that, it's just push, push, push. And their checks become fatter when they're denying the claims.
So it's easier to deny and then worry about it if they push it further.
Yeah, exactly.
Yeah.
And now with AI and all these algorithms that we hear about, it's happening even more.
Yeah, because you're not even getting denied by a human in the first stage, probably, right?
Right.
Yeah. Wow. So for the people listening, for patients and families, that might struggle with this or be concerned about this, what do you want them to know about their legal rights when it comes to mental health care?
I think, again, I'm still in my sphere of the world where I do health insurance claims. It's not something that many attorneys do. So I think people need to know that they have these rights. With mental health, the Mental Health Parity Law is obviously a very powerful law, and they need to know that they have the right to mental health care, just like any physical health care. If they're struggling to get a family member in a rehab facility, whether it be for mental health or substance abuse or any type of situation like that, they have rights, first of all, to ensure that they or their family member get this treatment because it's required. It is generally covered under these policies, and they have to just don't give up, right? If they're saying you're not sick enough, well then, you know what, talk directly to the treating physician and get that moving along, because they definitely have rights, and also talk to an attorney that can offer guidance in these situations.
I like that. Don't give up. Don't give up. Keep fighting.
Yeah.
All right. Well, thank you for tuning into From the Clinic to the Courtroom, Health Law Unpacked with Maria T. Santi, Esquire. To connect with Maria and the team, head to healthandmedicinelawfirm.com. And don't forget to subscribe to our channel and leave us a review. We got lots more stuff coming your way. Maria, thanks so much for being here. Really appreciate your time.
Thank you.
Thanks for watching. Be sure to hit that like and subscribe button and leave us a review in the comments.